First of all, I have a great deal of respect for all of my colleagues. This is a new day from the difficulties we had in 1993 and 1994. We will have a public health plan and we will have a responsible health care reform bill. With that in mind, we also not only have to pay attention to each other, but we have to pay attention to the needs of the American public. And so while we are listening to the differences of opinion, we have to rally around what is right. I believe, working with the White House and working with our leadership that has made a commitment on a vigorous public option, that is the basis of the bill that will be sent to the President's desk for him to sign. And I believe that the numbers in all of our districts, those who are low income but are working, small businesses, will be the test for encouraging their members to vote for what is right. That is to allow the great creativity of Americans who can be sole proprietors and know that they have good health care, or the young mother that is working on a low-wage job can have good health care, or the senior that is not yet eligible for Medicare can have good health care, or the person who is not fully compensated with disability or may not have been qualified for disability but has sufficient issues that would require a public health option. We believe that there is enough of those Americans scattered across blue dog districts, progressive districts, moderate districts, Republican districts, that is going to cause this Congress to do what is right. Yes, I have. In fact, I was in a tutorial that allowed us to go line by line and section by section. I will be reviewing the bill, but I have, and it is complex. It is broad-based. It has issues dealing with pre-existing diseases. It has calculations on the public option. It has issues about preventative care. It has information about federally qualified community health clinics, what I'm very excited about. It also has information about the pay-fors, which are very important. So we'll have time to read the bill for those who have not, and I recognize that it is mountainous, and if we had to do something in 30 minutes from now, it might be a challenge. But members are committed to going home to their districts, working with their constituents, and getting this right. Well, I think there's going to be a lot of heavy lifting going on in August, and we'll be doing heavy lifting in our districts. There'll be a lot of work here. Many of us will be in and out of Washington viewing the activities of negotiation. Some of us are negotiators from the caucuses. I've been working with the Progressive Caucus as vice chair and one of the 4 health negotiators, so I'll be keenly interested in what is going on. And as it relates to my state, the state of Texas, we have one of the lowest numbers of enrollment on the CHIPS program for our children. We have a sizable population that is young, that is in need of a vigorous public option. I know that this will benefit the state of Texas, and I'm looking forward to passing a good bill. I think we have a very strong and legitimate formula for payment. I would encourage all congresspersons to read. We have the recognition of individuals who are making certain levels that are far beyond the average American, $350,000, $450,000. People who are making that much money, businesses, small businesses that are over that amount. Obviously, there are smaller businesses that will be protected, but then it's so small. I think that's the point. We do have pay-fors, and we are looking to be fair, and I think the American people will believe that is the case as they get good quality health care, particularly in the rural areas where we will be seeing health clinics open up, doctors there for you, preventative medicine, hospitals that will be able to stay open. Why? Because we have a positive, good reform bill that talks about health care for all Americans and a vigorous public option. Good for all Texans.